Hypertension. Hypertension is also known as high blood pressure. Sometimes it is called high blood. It's abbreviated HTN. About 1 in 3 older Americans have high blood pressure. What is blood pressure? Blood is pumped from the heart to all parts of the body via arteries. The blood pressure is the force of the blood pumped against the arteries. The blood pressure reading is representative as two numbers. The diastolic pressure is the pressure when the heart pumps. That's your top number. The diastolic pressure is the pressure when the heart rests. That's the bottom number. Blood pressure. Blood pressure changes during the day. It can rise with stress and emotion. It is typically the lowest during sleep. What is normal? Blood pressure is always reported as a systolic and a diastolic number, and both are very important. Below 120/80 is normal. Pre-hypertension is 120/138/80/89. Stage 1 is 140/159/90/99. Stage 2 is greater than 160/100. How is it measured? Before having your blood pressure taken, do not drink coffee or smoke cigarettes 30 minutes before. Sit for 5 to 15 minutes before the test. Sit with back supported and feet flat. Never cross your legs. Arms should be at the level of the heart. The right size cuff must be used. What causes high blood pressure? The majority of these cases are of unknown etiology. Some cases are due to other causes. Medications can cause high blood pressure, drugs, primary kidney disease, and tumors. Who is at risk? African Americans, people who are overweight, people who smoke, people who have a family history of high blood pressure, and men are at greater risk. Signs and symptoms. There's often none. It is typically silent with no symptoms. Headache, blurred vision, chest pains, shortness of breath, and kidney damage can always be a sign. Complications. The heart can get large from the work overload, leading to heart failure. Blood vessels in the kidney narrow, leading to kidney failure. Arteries throughout the body narrow, leading to heart attacks, strokes, and amputations. Bulges can form in blood vessels, and they can burst. Prevention. Healthy weight, exercise, the DASH diet. Quit smoking, limit alcohol, and limit soda. Treatment. Medications, healthy weight, exercise and weight loss. Quit smoking, limit alcohol intake. Medications. Diuretics can decrease the excess salt and water in the body, which will lower the blood pressure. Beta blockers can cause the heart to beat slower and decrease the pressure. ACE inhibitors also decrease the level of an enzyme that narrows the blood vessels. Calcium channel blockers relaxes blood vessels. The DASH diet. The DASH diet stands for Dietary Approaches to Stop Hypertension. Diet low in saturated fat, cholesterol, total fat, red meat, and sugared beverages. Also, the diet is high in fruits, vegetables, and low-fat dairy, whole grains, fish, poultry, and nuts. The DASH diet lowers your cholesterol. Sodium. You should be taking in less than 2,400 milligrams of sodium a day. That's 1 teaspoon. Processed foods are high in salt. Always rinse your canned vegetables. Living with hypertension. Keep track of measurements. Take medications as prescribed by your doctor. Report symptoms and side effects of medications. Choose a healthier lifestyle. Women and hypertension. Pregnancy can cause hypertension, so can oral contraceptives and postmenopausal hormone therapy. Warning symptoms. The patient can feel shortness of breath, chest pain, headache, visual changes. Warning signs that you will be able to see. Decreased blood pressure or increased blood pressure. Increased pulse or decreased pulse. Other warnings are where you see the client is not taking their medications.